Okay. Good afternoon. This is House Labor, Health, and Social Services. And Donna, would you call the roll, please?
Oh, here she comes. Let me. Okay. All right. Representative Connolly.
Here.
Representative Flitner.
Here.
Representative Hallinan.
Here.
Representative LeBeau.
Here.
Representative Ottman.
Here.
Representative Romero Martinez. Representative Stivar.
Present.
Representative Worf.
Excused.
Chairman Wilson.
Yep. Okay, committee, we've got two bills before us. House Bill 1013, sponsored by Representative Connolly, and then the committee bill from June, House Bill 1006. I hope I have the right page things on that one because there's been so many versions. Okay, so first we'll consider House Bill 1013. Go ahead, Representative Connolly.
Thank you, Madam Chair, members of the committee. I bring you House Bill 1013, unemployment benefits failure to comply with federal law. Maybe I need to be closer. Thank you.
An honor.
Friends, when we were going into special session, it was just last week, and I took a quick look at the bills that were out there and the recognition that overwhelmingly, and in particular, that House Bill 1, right, that's being kind of looked at right now by the Minerals and Economic Development Committee. It was really about kind of what employers need to do and how employers would accommodate or look at federal mandates. And it was employer driven, and actually it was session law. And it occurred to me that there was little in there that was about employees. That bill, if you remember, it sets up severance pay, things like that. But what I wanted to do is actually think about an example that happened in my own community and a corollary in some way to HB1 that was more employee centered. And I'll give you the example that isn't this bill, honestly. All right, it's not this bill, because this bill is specifically about that complies with the special session being about vaccine mandates. But the other bill that we're not going to consider was actually something that happened in my community, which is we had public health orders and some businesses were not following them. What happens when an employee feels unsafe because the employer is not following a public health mandate? So our basic unemployment law is that workers are not eligible for unemployment benefits if there is what's called a voluntary quit. That is typical language that's used, a voluntary quit. You don't get unemployment, right? So our statutes have in it when employees are eligible to collect unemployment benefits when there is, in the language that's used in the law, is constructive discharge. So when there is a constructive discharge. And so what this bill does is simply add to our statutes that portion of it in relation to the unemployment benefits when a worker is eligible for getting unemployment benefits, an additional element to the list of constructive discharge elements. Sorry. So in most states, allow employees to collect unemployment if their work situation has grown so difficult that they're essentially forced to quit. And what I'm saying here is that if they are forced to quit because of dangerous working conditions, right, which we kind of acknowledge, that they will be eligible to collect unemployment benefits. So know that there are several examples in our statute right now, or that we expect to happen. So for example, an employer cannot ask an employee to do something that's illegal, right? And if an employee quits because of it, right, they're going to be eligible to collect unemployment benefits. There'll be all sorts of other kinds of proceedings that go on with that employer, but the employee can collect unemployment benefits. So what this bill does is simply allow for, and if you turn to the only portion of the bill or is relevant is on page 3, because the rest of it is already existing law, that it says that an employee is eligible to collect unemployment benefits if an employer fails to comply with any federal law, rule, or policy promulgated in response to the COVID-19 pandemic, including a vaccination requirement or any other COVID-19 prevention measure. That's good cause. So, Madam Chair, I'd be happy to take questions.
Questions for Representative Kennel? Representative Ottman.
Thank you, Madam Chairman. Representative, with this and unemployment, okay, we're saying that a health department mandate based on what? I mean, did they write it out? Is it in the health department rules in the county, or how does that work?
Representative Connolly.
Thank you, Madam Chair, and Representative Ottman. This is in relation to any kind of COVID-19 vaccination requirement or COVID-19 prevention measure. So that which we see from the feds, or we might see from the feds. So they would exist in writing.
Right. So just to be clear, so this, if you look on page 3, line 18, federal law, rule, or policy, not any other, if it wasn't. So this doesn't apply to local or state regulation, only to federal. Am I correct, Representative Connolly?
Yes, Madam Chair. So exactly. And so Representative Ottman, you might be confused a bit because I had a second bill, which is not this bill, which would have been local public health mandates. That's not this bill. This bill is specifically about any federal law, rule, or policy. And I understand there will be an amendment that I will accept that will take out policy so that you have a written federal law. And if an employer fails to follow that, and that's notwithstanding House Bill 1, right? House Bill 1 is going to be out there and have all different kind of state rules, requirements for employers in relation to the federal mandate, right? But that's notwithstanding what we do with House Bill 1. This says that if an employer is in violation, an employee who quits because of fear of negative health consequences is eligible for unemployment.
Madam Chairman, follow up. Yes. And just to verify this in my mind. So am I to understand that the federal government makes the health rules for my county?
Madam Chair, Representative Ottman, the federal government has lots of rules that are in place for employers in your county, lots of them. I mean, let's face it. I mean, we have some state as well, but child labor laws, OSHA laws, those are all laws that are in existence right now that your employers need to follow. Minimum wage laws, federal contractor laws, those all exist. And so this is no different than this is. So what's being talked about in terms of the pandemic is no different, honestly, than that enormous list of rules and regulations and laws that employers already follow.
I have one more follow-up. Okay, just to say there are numerous things for employers to do. So, but I think most employers that are under that guise, aren't they federal employers?
Madam
And
Chair,
wouldn't
Representative Ottman, no.
So let me give an example using the potential CMS rules from Medicare and Medicaid. We don't have this rule yet, but supposing by Christmas, there is a rule that says all employees of nursing homes shall be vaccinated. let's just suppose. And if the employer chooses to not enforce that, and an employee says, I'm concerned that I'm going to catch COVID from my employees because the employer is not following federal regulations for CMS, and they quit, they will be eligible for unemployment insurance. That's a federal rule that, I mean, anytime you take Medicare or Medicaid, you are impacted by federal rules. So what the bill would propose is that equal to what we're saying in many of our other bills, which is that you could get, I mean, we're trying in House Bill 1, where if there's an attempt to have people be eligible for unemployment insurance if they quit because they don't want a vaccine. This is basically saying you are also eligible for unemployment insurance if you quit because your employer is not enforcing a federal law and you feel it makes your workplace unsafe. Okay.
Madam Chairman, thank you. So if we were to vote this into law and there actually never occurs to be rules from a federal mandate, what happens?
Madam Chair, Representative Ottman, nothing. I mean, a worker would not have the ability to use this constructive discharge argument to claim unemployment. There would be no rules or regulations that an employer wasn't following that the worker could use as the reason for their honestly voluntary termination.
Because I don't see where it says specifically for this situation. So could it be anything down the pike, any kind of inoculation that comes along?
So Representative
Madam Chair?
Or Representative Ottman, do you have the right bill? It says yeah, House Bill 1013, page 3, line 19, promulgated in response to the COVID-19 pandemic. Yes. That's the only new language in the rest of the entire rest of the bill is existing law. So paragraph E is the only new language. Okay, just
Thank
checking. What questions
Okay.
for Representative Connell? Or did you have
And
a
Madam Chair,
follow-up?
if I just may answer more of a kind of, I think, a general question that I'm hearing from Representative Ottman. And it is that in general, Wyoming is statute light. We don't like statutes. We don't put a whole lot in our statutes. And so when it comes to kind of exceptions for workers to be able to get unemployment insurance, we don't have much out there, right? It is someone can get unemployment for a voluntary quit if there's a domestic violence situation. Actually, we did something just a couple of years ago when it came to service members, right? But so it makes sense that we actually put this in statute because of that lack of specificity, even though in general, we know that a worker could be or should be eligible if there's, for example, an unsafe working environment. What we're doing is we're specifying it here. We're making it easier for DWS to be able to kind of evaluate that claim. And honestly, that makes sense right now. We want DWS to be able to take a look at these situations and evaluate them and to be able to move forward and honestly to help that individual get another job, which is honestly what DWS does once somebody is on unemployment.
Okay. More questions for Representative Connolly? Okay, then I will thank you, Representative Connolly. Is there any public testimony on this bill 1013? No. Well then, public. You can come up and ask the question, although normally we don't always just answer people's questions, but and is it specific to this bill? Okay. Okay. If you can introduce yourself for the committee.
You betcha. My name is Susan Graham. I am a resident of Laramie County. And my concern is to understand more clearly that this unemployment benefit, because of a federal mandate, to Representative Ottman's comment, does a federal government control my medical decisions, but to unemployment. So as it stands right now, what I understand for some of my children and grandchildren is that if they, because of their employer, whether it's a federal employer or private, a corporation, which is, if they don't get a vaccine, they will forfeit their job and will not be able to get unemployment. However, what this bill would do is, if a person is uncomfortable, that their employer uncomfortable, fearful, as the senator said, that their employer is not enforcing a federal mandate over medical decisions of other employees, this person will get unemployment. Is that correct?
Ms. Graham, and that's specific to this bill. However, we have other bills that we are dealing with in this session that would address the concern that you had.
Oh,
about-
of that other, but
right.
this concern is specifically about unemployment for
Right. Right.
someone.
We have a single bill, a single issue requirement for bills. And so we are not, topics are addressed in multiple different bills.
Right. So
Right.
Chairman Wilson, am I understanding that my question about unemployment being granted to a person who is fearful because their employer is not using a federal mandate, that is what this bill is about?
That's correct.
Well, that's my question. It seems, or my statement, my observation and clarification, I believe you clarified it, that if someone does not follow putting a substance into their body, they will not get unemployment, while someone who maybe did get a substance put into their body, but is fearful that others in their same employment won't, they will get unemployment.
So there is another bill that
Well,
addresses.
but we're just talking about
Ma'am,
this
don't
one.
interrupt.
I'm so sorry.
You addressed the chairman. So I'm just saying that there are other bills coming forward that would give the first category of person unemployment. So that will be a separate bill, and that's being dealt with in a different committee.
Right. Well, I would say vote no on this one.
Thank you, Ms. Graham. Is there any more public comment on this bill?
Madam Chair, we have
I
one
hear a
person,
voice. Oh, oh, it's you. Okay.
Sorry.
Go ahead. There's someone online.
one person online with their
Okay.
hand up. Would you like me to admit
Sure.
them? I'm going to admit Holly McCamey Simone.
Okay. Are you there? Is she there? Holly?
Hello, can you hear me
Hello.
okay?
We can hear you. Thank you. If you'll introduce yourself for the committee, please.
Good afternoon and thank you, Madam Chairman and members of the committee. I'm Holly McCamey Simone and I'm with Workforce Services. I am the Workforce Program Administrator. And we did take a look at this bill and the UI division looked at it closely. It does meet the federal definition of good cause separation, as Representative Connolly mentioned. One piece that I just wanted to make you aware of is that those benefits that are paid out could potentially affect an employer's tax rating. And I just wanted to make sure that you all were aware of that.
Okay. Questions for, I apologize. I forgot your whole last name. I
That's
call you
okay.
Miss Holly. Questions for Workforce Services? Okay. Thanks so much. Representative Blackburn, can we help you? Have we forgotten the proper behavior in committee? Okay, thank you, Ms. McCamey. All right, then public comment is closed. Is this for somebody up here? Am I to auction it off or what? Sheesh. Okay, public comment is closed. Committee, do I hear a motion on the bill?
Move the bill.
Okay, moved by Clifford, seconded by Connolly. I guess you can second your own bill. Are there amendments on the bill? And I will tell you, committee, I have one on page 3, but any other amendments? The page 3 is the only action, so. Okay, committee, I'll tell you what my amendment is. So on page 3, line 18, it says an employer's failure to comply with any federal law, rule, or policy promulgated. My amendment would be to, after the word law, delete the comma, insert the word or, and then delete the words or policy. And my thinking is just that policy is not really defined. It's kind of vague. If it's based on, let's say Dr. Fauci's TV interview, I mean, it could be, it could change too regularly. I mean, at least a rule and a law there in writing. And I think that that's what we should be complying with. Do I hear a second on my amendment?
Second.
Seconded by Connolly. Any discussion? Question being called. All in favor of the amendment, please raise your hand. Everybody. All right, that passes. First success of the session. All right. Any other amendments? Okay, Donna, would you call the roll, please? Oh, Representative Connolly.
Oh, Madam Chair, if I just may address Ms. Graham's comments and to go along with the understanding that, again, I brought this in part because of looking at that HB1, and that HB1 looked at kind of one employee, not the other, right? And so I saw this as a necessary corrective to HB1, and this didn't fit. I looked to see if this would fit in the way that it was constructed, and it just doesn't. And so this to me is one of those, if it's good for the goose, it's good for the gander kind of arguments. And so it just makes sense. And in fact, honestly, it's less than HB1, which sets up a severance pay system. All this does is allow for an individual to have a constructive discharge, right? A good cause, and have the ability to collect unemployment. And so I would ask for the committee's favorable consideration.
Okay, Donna, would you call the roll, please?
This is a roll call vote on House Bill 1013 as amended, unemployment benefits failure to comply with federal law. Representative Connolly.
Aye.
Representative Flitner. No. Representative Hallinan.
No.
Representative Ottman.
No.
Representative Romero Martinez.
Aye.
I apologize, Madam Chair, I went out of order. Representative LeBeau. Representative Stivar.
No.
Representative Worf.
Excused him.
Madam Chairman Wilson.
Aye.
Madam Chair, we have 4 aye and 4 no and 1 excused.
Right, and the excused member has not left no vote, so that fails for on the time. Okay, next bill for our consideration is House Bill 1006, Vaccine Requirements Limitations Committee. We did see this, of course, in June. And there was some slight rewording in LSO as they drafted it up. And I'll just point out, let me just see. There was, for example, on page 3, line 6, reasonable accommodation means any change in policy, process, location, or other appropriate measures, like the bill that we looked at in Riverton said means. I mean, that's just I think there was a slight wording, but there was no change other than the committee's amendment in Riverton, which was to strike the word sufficient, if you recall that amendment passed in committee. So just for the benefit of those people out listening, I'm just going to briefly touch on the components, and then we'll just proceed into discussion and all that, because we have heard this before. So those of you out in the audience, we're on House Bill 106, Vaccine Requirements Limitations. This was actually sponsored by the Labor Committee. It's I think one of the only committee bills that is being considered in this special session. And the reason for that is back in the spring, when the Labor Committee went to Management Council to ask for allowable topics, we, being the Labor Committee and having foresight, said we want to discuss immunization requirements, and that was granted to us. So the bill was drafted. To be honest, I drafted it, and then had LSO legally do it, and we discussed it at the Labor Committee in June, and it was passed. Initially, we thought that it might be suitable for a special session if we had one in July. That didn't happen, but it was determined by LSO that we had voted on it for special session, so we have this now. this bill does not specifically deal with, let's just say it was drafted and voted on before the September federal mandates came out, but it dealt with things that we could foresee in a number of different areas. The other thing that is a little bit different about this bill than the rest of the bills is that it was drafted not specific to COVID. And my thinking, at least, and I suppose the rest of the committee, was that the issues that we were dealing with should be the same, whether we were dealing with a vaccine requirement for COVID or one for cholera or Ebola or whatever might come forward in the future. And so that's why it is that way. I don't know, it's possible that there might be amendments somewhere along the line to make it specific to COVID. Personally, I like it the way it is, but that's not up to me. So just so that people can hear the overview, it basically has 4 separate categories. On page 2, the requirement is that a healthcare facility should provide a reasonable accommodation to people wanting to visit a patient. And let me just refer, when we saw this bill in June, LSO had the note about reasonable accommodation. This is an existing legal concept that has existed in law for probably 20 years, at least, since the Civil Rights Act of 1964 and the ADA. HR people and the courts have dealt with the concept of reasonable accommodation for years. And it doesn't always mean the same thing. What's reasonable for an employer of 2,000 people is not necessarily what's reasonable for a welding shop of 4 people. So that's an existing concept. And we don't attempt in the bill to state what is reasonable when there's such breadth of possibility. We just leave that up to how people treat it already. So page 3 just has the standard definition of reasonable accommodation. Page 4, picking up on the bottom of page 3, equal enjoyment of public accommodations. This goes into our existing public accommodations law. And I'll just say for the audience, looking at some of the executive orders and laws that we saw nationally in the spring dealing with vaccine passports, it seemed to me, and the committee agreed for the most part, that they were not balanced in that citizens, patients have rights, but also business owners have property rights. And so the bill attempts to use existing legal concepts to balance those. So what we do on the top of page 4 is say that a provider of an essential service or product shall provide a reasonable accommodation to any person who is unable or unwilling to provide proof of immunization. Then paragraph 1, beginning on line 7, defines essential service or product. This was based on what's called NAICS codes, which is a national occupational codes. The CDC had used that list of codes when they said these are essential services. It was for the purpose of deciding who can get priority to vaccination, but we use that. And my thinking in writing this, as I expressed to the committee at that time, was that I feel that there are certain services that people have a moral right to: groceries, banking, gas station, doctor, funeral home. I don't feel that a person has, and excuse me, any tattoo parlor owners out there, but for example, I don't feel a person has a moral right to get a tattoo. So if a tattoo parlor owner wants to say, I won't give a tattoo to someone without a vaccine, I feel like that's his business owner's right. And I don't think that would be a good idea in Wyoming, because I think you would lose a lot of your clientele, but I don't think we can mandate that. So we're only attempting to put this requirement on the essential services, which are listed in paragraph 1. And again, the idea is that they shall provide a reasonable accommodation, as I say, an existing legal standard. So for example, a grocery store, if for some reason the grocery store wants to say you can't come in without a vaccine, they have to provide a way for you to get your groceries, deliver them out to your curb, whatever your PA consult needs to be able to do by Skype, or refer to somebody else, or a drive-through banking, or whatever it is. But the reasonable accommodation, there are some things you should be able to get. That's the tool that we're using for that. Page 5 picks up mandatory immunizations for children. Now, all of the language on page 5 is existing language. There's no change to the existing language there. And just so that people who are hearing know, existing procedure is if a parent doesn't want their child to be vaccinated, they have medical or religious excuse, you can go to the county health officer and they must excuse you. The child can still go to school. That, I think a lot of people have not realized that. The child can still go to school without the vaccine. If there is, say, a measles outbreak or something, then the school sends the child home. That's existing procedure. Nothing about this would change the procedure. And interestingly enough, in the early 2000s, we had 2 Wyoming Supreme Court decisions that said that there were 2 separate cases, 2 separate parents, 2 separate children, 2 separate locations. In one case, there was a parent who wanted a medical exemption for their child, and the local health officer wanted more explanation, tried to say that this is not a good reason. Your doctor had a bad idea. The Supreme Court said, no, it just says in law that the doctor signs off and says medically contraindicated, and that's all you get to look at. You don't get to explain or argue or anything. The other one was a religious exemption. And again, the state Supreme Court has ruled that the health officer may not require the parent to explain scriptural reasons or get a statement from the rabbi or any such thing. If they say a religious exemption, that is what it is. So in this part, the only change here is on page 6, line 11, we insert personal objection. My reasoning for this is this. I think that there might be, let's say, vegans who object to vaccines developed on eggs. It's not me, but maybe that's their objection. Would that pass as a religious exemption? Maybe not. But I feel that it is still a reason for a person to get an excuse. And I don't want people to have to come up with a fake religious reason when they didn't really have one. I mean, I try not to encourage people to lie. And so that was why we put in personal objection. Turning the page, top of page 7, there's a paragraph about an immunization shall only be mandated. This is specific to the K-12, or actually I think probably the preschool one too. A 5-year period after the approval of the vaccination. And I will freely admit, the committee heard this before, I just pulled the number 5 out of my pocket. But I felt that it was a good idea to not mandate any vaccine, whether this or some future one, until it's been in existence for 5 years to make sure that the children are protected. Then on the bottom of page 7, we go into unfair employment practices. This is the current section of statute, Title 27. We have a number of things that are, whether they're unfair or not. And again, here, it would be considered an unfair employment practice if an employer requires an immunization. Then we have basically existing type exemptions starting in line 17, unless the employer can demonstrate that it would create an undue hardship, which is existing legal statute for anything. You have to make reasonable accommodation, let's say for a woman who's pregnant, or for a Muslim who doesn't want to deliver beer. That was an actual case in Chicago. If there's an undue hardship, let's say the Muslim beer driver is the only truck driver you have, then that would be an undue hardship. Those are examples. Or a direct threat, not necessarily a hypothetical threat. I'm not an attorney, but that cannot be eliminated or reduced, I'm on line 21, by means of a reasonable accommodation. So again, we're using existing legal concept of reasonable accommodation. We're not creating new legal concepts in the bill. And then bottom page 8, line 18 adds religious or personal grounds. I think we have probably some amendment from Representative Hallinan later on this. The whole thing, like, if you were a vegan or something or other, and I just was trying to be fair to people's objection categories, not make them fit into so one. So committee, that's a reminder of the bill. And as I say, it was amended in our Labor Committee meeting to take out the word sufficient. Other than that, it's the bill you already know and love. Any questions from the committee? No. All right. Is there any testimony from the audience? Just kind of come up. We've got 3 chairs up there, so sort of 3 people at a time can come up and present, introduce yourselves, and we'll just kind of work through. And while I'm, hang on here, before we start, let me just check and see, in case we have a lot of people. We should really have clocks in these committees, shouldn't we? Just 1 minute here. Folks, I don't have my phone. Okay, it's 3 o'clock. Hopefully everyone in the room doesn't have 10 minutes worth to say. I want us to stop by 5:30 of public comment so that we may work the bill and be done before we all fall asleep or something. So just kind of a warning there. The room doesn't look too, Donna, do we have anybody online to testify for this bill?
Madam Chair, if you'd like to instruct any attendees to raise their hand who'd like to testify, right now there are no hands up.
Okay, if as far as people by Zoom, 2 there.
Now 2 hands up.
Okay, just out in the audience, how many people are there that want to testify in this bill? Oh, not too many. Okay, good. Well, that doesn't mean you can have 20 minutes though. And let me just also say, and I before we start here, just because, you know, there are probably people here who've not been in committee before. It's important to focus your testimony on the specific bill before us. So if the topic is in the bill, and of course, these are all about vaccine mandates, so you probably can't get too far astray, but let's say, don't bring in something like federal employees or the military or something, because that isn't a topic of this bill. So just kind of confine yourself. Okay, I think that's all the comments that I have to say. Welcome, and we'll just start with these 2 gentlemen because they kind of came by themselves, ma'am, and then I'll go with you. If you'll introduce yourselves, and I think I met you in the hall this morning, although you had your masks on then, so I'm not entirely sure, but introduce yourselves for the committee, if you would, please.
Thank you, Madam Chairman, members of the committees.
Is your thing?
It is. I might need to speak
Okay, there you
closer. Thank you, Madam Chairman, members of the committee. I'm Grady Hutcherson. I'm a 24-year classroom teacher at the elementary level, and I now proudly serve as the president of the Wyoming Education Association.
Madam Chairwoman, members of the committee, my name is Tate Mullen. I'm the Government Relations Director for the Wyoming Education Association. I've got a few written statements. Sometimes I just do better that way. I promise I will keep it brief, and then I'd like to ad lib a little bit at the end.
Okay.
So the one word in this bill, in the amendment to section 214309, has some substantial potential public health and safety implications for our schools. The personal objection piece in there, we feel, is far too broad. The fact of the matter is that those exemptions, the ones that we have in there, are there for a reason. This language expands that to too far broad of a category. That basically those objections are there. And the reason that we have these vaccination mandates is because of decades of science of what tells us what vaccines do for our students, what happens in our schools. As somebody who taught college level political science, one of the things that we had always started off with was there's always this fundamental discussion between rights and securities, and that those rights and securities, there's trade-offs. One of the very fundamental pieces that we always had to teach our students was that none of our rights are absolute. And once you start getting into some of the complicated nuances of it, you realize that the government does, when there is a substantial risk to public health and safety, they have the ability to intervene. And what we have seen, and the reason that we have those vaccine requirements, is we saw what happened when we did not have those. We expand this to a personal objection. And basically what that does is just let somebody, for any reason, decide that they may not want the vaccination. That has the potential to open up the door to some severe public health and safety consequences for our students, for our educators, for our staff, and not only for them, but for the child care workers and the grandparents that take care of those children after the school day is done.
Mr. Grady?
Madam Chairman, members of the committee, I just want to share a little bit of a personal story with you all. Having taught second grade, for over 2 decades. I can share with you that elementary schools are often referred to as petri dishes. There are lots of germs, and I share that just because I have that experience. I've seen what happens every year during the cold and flu season. We know that these mandates for vaccinations are to protect our students and all of the employees within our schools. And by adding, with the proposed amendment to just add personal objections, it potentially undermines the entire vaccination system and the rationale for it at our public schools. And because of that, we're then putting at risk our students and education employees. And because of that, we're very concerned with the amendment in the bill. So thank you.
Questions, Representative Star.
Thank you, Madam Chairman. So, gentlemen, I have a son that graduated high school. He has a religious exemption from vaccines. So I like that personal objections because more or less it ties into 14.2206 parental rights. What's your say to that, sir?
I'll just call you gentlemen as a group, if I may.
If I can get my microphone working. Mrs. Chairwoman, Representative Syvar, we shouldn't confuse those two, okay? Again, I'm going to come back to the idea that that is throughout constitutional case law, that if there is a public health and safety, if there's a substantial public health and safety cause, governments can step in, and we have seen what happens when they don't step in. If we didn't have these vaccines, what we have seen time and time again, and we've seen it sporadically throughout, is that you have pockets of sick students. And one of the reasons that we object to this is we know what happens when students miss school because of illness. Now, we know this isn't going to cure all the illness. That's not the point. The point is that when students are sick, when they miss school, it detrimentally impacts their performance. Ultimately, at the end of the day, we want our students to be healthy and we want them to perform well. And this is a means to make that happen.
So I do have a question about that, and I'm looking, I have my computer here, but so not half, but maybe a third of the states now do have personal exemptions. So I see, for example, that Colorado allows not just religious and medical, but also personal. So do you know, are the number of unvaccinated children, is it higher in Colorado? I'm just trying to look at the surrounding states. I didn't count them all up, and I won't spend on, but so, being close to Colorado. I guess when I look at the public health data from the Department of Health, it seemed to me that like Laramie County has only got something like 65% of the 7-year-olds vaccinated for MMR, which this seems astonishingly low. It surely isn't all. I'm not sure what the reason is for that, but do you have any knowledge of the 20 or so states that allow personal exemption, whether their vaccination rate is significantly lower than ours?
Mrs. Chairwoman, I do not have that information. I can look and see if I can find that and provide that for you.
Not for right. I won't ask you to right now.
Fair
More
enough.
questions for folks? Representative Ottman. I'm just going to change your seat next year so that you can get a better.
Yeah.
Go ahead, Representative Ottman.
Thank you, Madam Chairman. Hello. I appreciate your concern about all of this, but I do have a couple questions. First off, with a mandate, well, no, just say there's a health problem that we're all concerned about. Why would that not be able to be handled by the county health person and then given to the individual districts? I don't see, because I know districts, I also worked in education for 15 years, and I know how things spread, how they get over with. And what I guess my question to the WEA is, how how this all works. I never really saw the WEA in the school. I did see publications. I did see things. And one thing I've been trying to find out is where's the WEA as far as what is your position and what are your actions on protecting your the teachers that want this health freedom, because it is not proven. One of the things that I'm concerned about, I guess, is that the teachers that I know are all very dedicated people. They work tirelessly. They work endlessly. They work lots of hours. Why would they want to do something that would not only put the children that they serve at risk, but themselves and their own families? I guess I don't understand your position on that.
Okay.
So
If I can just, so Representative Ottman, specific to the childhood vaccination, is there, can you refine your question just so that are you asking about their statement about the vaccine exemption, or are you just being glad that they're here and you want to ask them about?
well, I guess I'll be
Teachers.
more specific
Yeah,
because
you be more
a
specific.
thousand things are going through my mind because I've been real interested
And I
with a
don't want
lot
them here
of
for an hour.
the information that I've read that has been put out from you. So I guess what I'm asking is what positive steps are you taking through the WEA to make this work other than requiring that all people get an inoculation?
Okay, that's a good question.
Do you want to feel
Go
this,
ahead.
or do you want? All right, Mrs. Chairwoman, and Representative Botman. First of all, I would like to reiterate a great point you made. Our teachers do work countless hours. They work incredibly hard. And I think one of the things that has gotten lost in transition over the past year, a year ago, we were heralding our educators as heroes. And unfortunately, what we have seen in the past year is they have come under fire. So it is incredibly frustrating for us to see that, but we are greatly appreciative of all of our educators. We have within our membership the gamut within a school, right? And the structure of our organization, we have ESPs, we have paraprofessionals, we have locals within each district, we have local leaders, we have presidents, we communicate information to them, we provide opportunities to determine what is going on in your district. What are your concerns? What are you seeing as problems?
Oh, and just 1 second, and I know you're answering Representative Ottman's questions, but seeing as I did tell everybody that they should confine their testimony to the bill, make it a short answer to Representative Ottman's question.
Yep, absolutely. We work tirelessly with our local leaders to make sure that we are addressing their issues within their districts. And we do a lot of surveying, we do a lot of outreach to our members throughout the state and every district to make sure that we are representing their interests as well as their health and safety of our students.
Okay, any more questions specific to the vaccine mandate question in the bill? Representative Stivar.
Thank you, Madam Chairman. So Representative Ottman brought it up. This is not a vaccine. This is an inoculation. I mean, look at the difference. So you know where I'm going with this one, right? The COVID-19 vaccine, what they're saying is a vaccine, is an inoculation. It takes more than one shot. So you're just concerned with vaccines, correct? Not inoculations.
Okay, I don't think he can probably answer that as not a clinician person. Let's just
Thank you, Madam
go
Chairman.
on from there. Thank you for that. Okay, no more questions for the WA? Thank you.
Thank you.
Okay, ma'am. Representative Romero Martinez.
Madam Chair, thank you. I'm working to be concise with my question
We
regarding.
will all follow the model of the new Representative Williams, who gave a 5-word response when he was asked for his words. Go ahead, Representative Romero Martinez.
In regards to looking at this bill, looking at personal grounds versus religious exemptions, and if you can give me just kind of I guess a summarized short form, what has your department done, or the Wyoming, the Education Association. What has your group done to reach out to get the take of the faith-based community? If you could please answer that.
Mr. Chair, or Ms. Chairwoman, what we have done is, again, this is talking to our broad-based membership, right? We do have members that have applied for religious exemptions. And with the EEOC language around religious exemptions, we have no problem with that whatsoever. So that's something that, if that's something they want to pursue, that's something that they will pursue. Our objection to this is strictly only to the personal objection.
Thank you. Okay. Thanks very much. Okay, ma'am, introduce yourself if you would, please. Could you pull the microphone a little bit closer to you? Oh, yeah.
Thanks.
There you go. Okay.
Sorry about that. I am a nurse and a paramedic. And first of all, I would like to say thank you for adding the personal clause to this. I have a lot of coworkers who say, I don't want the COVID vaccine based on religious exemption, but I don't want it. So I don't want to lie, like you were saying. So I appreciate that grounds in there, and also protecting the rights of parents to do the same to their kids. Some concerns that I have, your clause that talks about, trying to find it, the 5 years. I appreciate trying to add something for to prove the safety of the vaccines. My concern is that I think it needs to be more specific. I think we need to add something that specifically addresses that it's been proven that there are not excess deaths, excess disability, or other similar things, because we're already seeing with the COVID vaccines, with previous vaccinations, such as the H1N1 vaccine, it was discontinued after 51 deaths. We're at 17,000 per the VAERS website. So even if the CDC or these people, it passes this amount of time, I think there needs to be greater protection saying, what are we actually seeing with the numbers, if that makes sense.
Yeah, it does. Okay, question, and I'm sorry, I didn't hear your name.
Jenny Michaud.
Okay, sometimes it's easy. I hope you don't mind if I just call you Jenny.
No, that's fine.
Okay.
And my mic was off. So.
Questions for Jenny?
And if I,
Oh, I'm
if I
sorry, I
may,
thought
I
you were
have
done.
one other thing. The section that talks about the public entities. I appreciate
could you
that
tell
we're
us what-
trying to.
Do you know what page number you're on?
It doesn't have page numbers on here. It's just the very beginning part that talks about essential services provided and acceptable accommodations.
Okay.
My concern with this section is that in healthcare, healthcare privacy is a sacred thing. We have HIPAA to protect that. To me, this sets a precedence that these public entities would even be allowed to ask vaccination status in order to provide a service. And I'm very concerned with that, as it seems it would be a gateway to a vaccination type passport.
Questions? Ms. Representative Flitner.
Madam Chairman, thank you. And I just have a comment. We hear in the legislature a lot from individuals who represent organizations, and it's really a breath of fresh air to have a citizen all the way from Sublette County. I know how far away that is. So thank you for taking the time to testify in front of this committee today.
Thank you.
Representative Stiver.
Thank you, Madam Chairman. I just want to get clarification. You said how many deaths from the vaccine?
Currently, the VAERS website, which records adverse effects, reports 17,000. And actually, a Harvard study shows that that only catches approximately 1 to 10% of what actually happens.
So if there's 17,000
Representative Stiver.
follow-up, because my understanding is they changed it where you're not fully vaccinated until 14 days after you get the shot.
And I could go on all day about numbers and data, but my concern is that with the politics going on with the COVID vaccine, it should already have been
Inoculation.
discontinued. Yes, it should already have been discontinued, especially in the child population where we've seen a lot of myocarditis, and I want to make sure we're protecting our children by having more specific language. That's all my concern would
Okay.
be.
Further questions for Jenny? Okay. Great, thanks very much. Okay,
you.
we'll let you swap out. We've got two new folks. And just a reminder to people we have sort of a legislative procedure just to make sure everybody stays organized and always make sure to go through the chair. So if I'll call on you and then even if, and then you can see how I call upon other people, then answer me first, even though you know it wasn't me that asked the question. Thank you, Madam Chairman, and then answer the question. That's just kind of our process, keeps everybody orderly. Okay, are you together or just happen to be sitting next to each other? Okay, I'll just start from my left, man, and then if you just introduce yourself for the committee. And yes, press the button right
Yeah.
there, kind of closest to the end, and
Can you hear me?
we can hear you great. Thanks.
Okay. Madam Chairman, members of the committee, thank you. My name is April Kranz. I am a resident of Laramie County and I am an internal medicine and pediatrics physician.
Okay,
I have several comments here, which I hope will sound somewhat organized. The first thing I want to say is that I'm hearing a confounding in the discussion of personal objection to the COVID vaccine with what is my understanding of the body of the bill, which is actually talking about personal exemptions for required childhood vaccinations already. And so I want to make sure that distinction is clear. I'm sure there's lots of people who have personal objections to the COVID vaccine, which no one is talking about making that a mandatory vaccine for children at this time. So I don't think that that's really a relevant argument at the moment. Also, the primary thing I want to say is that with the advent of just rampant misinformation available on the internet and social media, in which basically any statement that anyone wants to say can be promoted and repeated as fact, this personal objection clause lowers the bar way too much and makes it too easy to put our children and our communities in danger by diluting herd immunity. I don't think that personal objection, which is becoming, I would say, culturally kind of a fad to have a personal objection to just about any mandate or recommendation from a learned scholarly body, I think is going to really put us on thin ice when it comes to very serious health consequences that can be that we're going to be looking at if this goes forward. Also, I don't think personal objection is, especially because vaccines are not 100% effective. No vaccine has ever been 100% effective. And when you choose not to vaccinate your child, it's putting everyone around them at risk because that child, the neighbor who may have been vaccinated, there's no telling if they're going to be the one who the vaccine doesn't work for, or they have a complicated medical condition that makes it such that vaccines are less likely to be as effective in that person. That person is also at risk. And if we look at the vaccinations that are currently required for school children, we're looking at polio and diphtheria and pertussis and measles. Again, herd immunity such that, so many people are vaccinated that even though these vaccines are not 100% effective in every individual, is keeping us safe as a community, is keeping our children safe. And I think anything that puts that protection at risk is a bad idea. I want to also say that there was a point brought up earlier about the COVID vaccine not being effective at preventing infection. And what I can say for sure is that with the Delta variant, we definitely have seen that even fully vaccinated folks can get infected. But what there is no ambiguity about at all is that this vaccine, the COVID vaccine, definitely protects people from severe disease and hospitalization and death. And so when we're talking about a pandemic that is putting stress on our local healthcare resources, I think it's very relevant to be talking about, even though the vaccine doesn't offer 100% protection as none do, and even less than 100, far less than 100% protection against infection and being contagious with the Delta variant of COVID. I think it's still very important to recognize that this is vaccination is protecting our healthcare resources and keeping us at least in the black as far as not being yet in a position where we're having to ration healthcare. Nobody wants to get there. I think my last comment here is that the 5 years, when, as you admitted, is an arbitrary timeframe. And I think it is far more important to really be very specific about the science that's going to be involved in any future contagious disease that vaccines are going to be indicated for. I think it's dangerously short-sighted to put a time frame like that on this now, where, yes, we're in a pandemic now, but that says nothing about what could be the next big infection that comes down the pipeline, or what if there's going to be a different COVID variant that comes around, a year or 2 years from now. And I think especially as much as, of course, it's all of us want to protect children, it's also important to not deprive children of the benefits of proven therapies. And so I want to encourage you to also keep that in mind. Thank you.
Questions for Dr. Krantz? Representative Connolly.
Thank you, Madam Chair. And Dr. Krantz, thank you very much for being here. I really appreciate you coming and honestly giving us a medical and scientific view based on your massive education and experience in the community. And so my question for you is, and you talked a little bit about herd immunity. That's something that we haven't heard much about. And so I am curious about what you think will happen if we include a personal exemption. Will we see more kids come to school not being immunized because of a personal objection of their parents? And what could happen in our schools because of that?
Dr. Krantz.
Madam Chairman. I do think that we will see more kids come to school without being vaccinated. And what are the potential consequences for that? I think, we could definitely see a resurgence of measles and mumps. I mean, this has started to happen around the country already in small pockets. I think to invite those incidents to come to our state is a mistake. But yes, I suppose it's my personal opinion, just sort of seeing what I see and hearing what I hear in our community about now all of the controversy around COVID, I think is definitely going to put us in danger of parents just saying, oh, well, I don't trust any vaccines. And I heard on the internet or I read on Facebook that all vaccines are bad. And now, because I read that, I am now going to take advantage of this personal objection clause to not vaccinate my child.
I'm sure. Follow up.
Does that answer your question?
Yeah.
I'm sorry.
Yeah. Thank you, Dr. Krantz. Now, my next question is about, have you ever filled out a medical exemption for a child for vaccines?
I will have to plead that I don't do primary care pediatrics anymore. I do hospital-based pediatrics for the past 4 years. And so we don't administer vaccines in the hospital. So I can't remember having done so.
Okay. All right. Thank you. I was just curious what that process looks like. Thanks.
So if I can then follow up on a question there. So, and I don't have my computer screen has gone black again, and I didn't have it lit up this time. But so looking at the Department of Health's, they have report cards for each of the districts. And they used to have one where you could see all the last 5 years. And that one seems to have kind of faded in the back, or you have to really search on it now. It's not the first thing that pops up. But I remember finding that Laramie County, and it was on 7-year-olds, was only like 65% vaccinated against MMR. And I'm like, I couldn't even imagine how that could actually even be. But so what I'm wondering, do you know, excuse me, evidently in my list of states that do have personal exemptions, which I counted and I forgot the number already, I think it was like 20, Colorado being one of them. Does Colorado have a lower vaccination rate of children? I mean, as far as do you know anything about that?
I don't know.
Given that they've got that potential.
I do not know. I'm sure I could get that information if you'd like.
It would be interesting to know. I mean, obviously the demographics are different and there's, so I wouldn't know, but I mean, it would be interesting to see if the states that have personal exemptions in existing law have in fact lower vaccination rates. I mean, that would be valuable information. But okay, any more? Let's keep on moving. Remember, Representative Ottman.
Thank
Concise.
you, Madam Chairman. Yes. And Dr. Krantz. What I was wondering is with this, since this inoculation has been in production and everything like that, and it was done relatively quickly, I realized, because of a crisis. But since the clinical trials really are ongoing and we are part of that as people with the inoculation, people without the inoculation, different age groups and things like that going on. What I'm wondering is how can, because there's different expert opinions in your field about whether or not this is a good idea or whether it isn't. How do you explain or help me understand why it really should, why there shouldn't be exemptions? Thank you.
Dr. Krantz.
Madam Chairman, are we talking about the COVID vaccine now? It sounds like we're talking about the COVID vaccine.
Right. So
Yeah.
Representative, just to be specific, the paragraph in the bill would apply the personal exemption to all categories of pediatric K-12
Okay.
vaccines. But so if you wanted, we'll
Oh,
just,
okay.
I think, address that.
Thank you, Madam Chair. Yes, I'm sorry. You had said too, so this will go along with that. You had said too, we may have outbreaks of measles again. Well, that hadn't been really taken out. Is that because of so many incidences of people coming in that don't have the vaccines that we already require? What I'm just wondering is if, since there is, I mean, I know your expert opinion is this, but there's other people that have other sides to this story. And I'm just wondering, how can we differentiate between what we can actually positively know at this time about these? I just want to say for the record, I've had some vaccinations, but it was a choice, and they were proven over years of trial. And where my problem is here is where this is not clinically proven yet because we're still in the trial stages. So how can we not have personal exemptions in that right?
Madam Chair, so I think since it sounds to me like you're talking about the COVID vaccine, and I'm not specifically saying that we should not allow personal exemptions for the COVID vaccine. I'm saying that we should not allow personal exemptions for existing required childhood vaccinations.
Good clarification. Does that make sense? So Representative Ottman, if you look at the bill, the bill on page 6 inserts personal objection into the entire immunization requirement statute. It's not specific to COVID like some other bills that we are considering in this session. Okay, does that make sense?
Just one more clarification maybe from you.
Okay.
So where does that put? So we're just seeing it whether we want this part of the bill here. Is that what you're doing? Is that what we're doing?
Okay, so the
I'm
bill,
sorry.
if you look on page 5,
Yeah, I have it
the
right.
title that we're amending is mandatory immunizations for children attending schools.
Yes.
Okay. Presently in this state, not being California, in this state, there is no requirement for a COVID vaccine of any kind for children. However, because we drafted the bill to affect everything, the global bill of the world, the insertion of personal objection applies, says as on line 7, personal objection to the administration of any vaccine. So that's why people are bringing up other issues like measles and things, because we are amending the entire K-12 vaccination statute. If we want to make personal objection only suitable for COVID vaccine, that is an amendment. But right now, the personal objection is amending the entire child immunization statute.
Okay, thank you for that clarification. And I still would support a personal exemption because of all the additional vaccines that are being required.
Okay, let's
Thank
move
you.
on to the next person. If you'll introduce yourself for the committee. Thank you.
No, if there we are. Are we on?
It sounds like you're on.
Madam Chairwoman, ladies and gentlemen, my name is Dr. Ken Kranz. You just had the opportunity and privilege of listening to my daughter. She's brilliant.
Well done, Dr. Krantz.
So
Dr.
a couple
Krantz.
of comments, and I'm just going to talk, and hopefully you all will connect the dots. So first of all, with respect to childhood vaccines, years ago, many of us had the polio vaccine. There were pockets of individuals around the country that did not. They got polio. Their kids got polio. Polio now does not exist in our country since 1979. That was the last active case native to the US. It's still present around the world, but any cases in the US are brought in. They're not native here. Vaccinations work. Polio's gone. MMR, almost gone, but not quite. There was an inoculation many years ago, and probably one or two of us have had this, and that's the smallpox vaccination. That was an inoculation because that's a live virus. Smallpox is gone because it was a mandatory vaccination. And you all have probably read there was a US Supreme Court ruling about the smallpox vaccination. That was in the presence of an epidemic, just like we're in an epidemic right now, pandemic with COVID. And the US Supreme Court said that there is a benefit to the community that supersedes individuals' freedom to refuse the vaccine. US Supreme Court. It's a long time ago, but smallpox is gone on this planet. That's really important information. So all of these vaccines, imagine how these viruses are going to spread and grow throughout our community just by personal exemptions. Oh, thanks, I don't want a vaccine. Oh, I don't like needles. I don't want my kids to be exposed to needles. It's going to be so traumatic. But the benefit is to the greater good of the community, our state. So personal exemptions, I really don't believe has a place in any of these vaccinations. So that's point one. When school opened, there was no masking. There was last year. And not only was it effective at allowing the schools to stay open, kids didn't get sick. And when kids didn't get sick, parents didn't get sick. You heard earlier that kids are a petri dish. Oh yeah, they really are. So the school district here in Laramie County, District 1, as you all probably know, instituted a mask mandate, way less effective than vaccinations. Well, during the first 2 weeks, there were 1,000 students and staff that had to be quarantined because of either exposure or active infection. After the mask mandate, it went down to 350. Vaccinations are even more effective. And I think we should push them rather than find ways to exclude individuals from getting them. So please take that into consideration. We're looking out for our state. We're looking out for our children. And when the kids are sick, parents have to stay home. They're not working. It's a huge cascade effect.
Questions for Dr. Krantz? Representative Stein.
Thank you, Madam
brief
Chair. Just a comment. All right. One is the reason the numbers were so high in the school district.
I'm sorry, sir.
The one reason I believe the numbers were so high in the school district, 1,000, is when one person in a class got it, they quarantined the whole class.
Yes, sir.
2, I said, I've got a son that has never had a shot in his life. And I had a doctor from here in Cheyenne said, don't vaccinate. All right. You look at some of the military people, vaccine records, they say vaccine A, vaccine B. We don't know what they are. All right. And some of the tainted vials during the Gulf War had microplasmy in it. All right. All my kids that we gave, the kids that got the vaccines, my kids, all ended up with MS, diabetes. I think it's the parent's choice. I think it's personal choice, and I will be voting to keep that in there. Thank you.
Do you have a question for Dr. Krantz? Okay, any more questions for Dr. Krantz Senior?
Madam Chair.
Representative Connolly.
Thank you, Madam Chair. And Dr. Krantz, I too would like to just thank you for being here, and I'm sure you're a proud papa, and for your testimony and coming to speak with us today.
Representative Romero Martinez.
Madam Chair, Dr. Kranz, I'm wondering, and I don't know if you could walk me through this. I'm not in your shoes. Regarding the exemptions, is there any, what can we do? Is there anything we could have done better to work to get ethical vaccines down the pike? There seems to have been a miscue or miscommunication. The individual from the Department of the Education group had said that they do everything in their power to have open dialogue and represent all of their constituents, but it looks like it was pretty clear from the beginning when they started the work, even though there had been a lot of protocols in the process for decades, obviously, a lot of different doctors that we've seen online and through television that have been working, even some individuals have been working for a vaccine of vaccines that will just get rid of all versions of COVID in the future. And I don't know that you could answer this. I think it's kind of, I don't know if the right animal to say that's in the room, but basically it's just this underlying issue with exemptions. I guess, what could we do? Maybe not have done better, but what can we do now, since we can't retrofit the past or whatever, but what can we do now to try to address issues people may have regarding exemptions and regarding ethical vaccines?
So let me just try to rephrase that, because I'm not sure that I entirely
Thank you.
understood the question. Well, I'm going to ask you. So are you asking Dr. Krantz to, and I didn't hear what your specialty was, but to talk about going forward, different ways to develop vaccines that might fit within existing religious and medical exemption requirements? Or, I mean, I'm sorry, I didn't really understand what you're asking him to.
It's because I
answer.
put a lot of paragraph descriptions and
In here.
storyline between there. I think
Try to trim that down a little bit.
I like your trim down. Yeah. So what can we do to?
And I don't
what can
know,
we-
perhaps. for
I don't
all we
know. Maybe
he
let me try to
operates
do it.
on gallbladders and has no opinion, but go ahead, Dr. Krantz.
Madam Chairman. Chairwoman, my bad.
That's no chairman is fine.
So probably must be 15 or 20 years ago, you may have all heard, oh my gosh, if you get kids vaccines, they're going to get autism. You all remember that? Some of you remember that? Well, the guy who was in England, he's the one that published that. He's in jail now because he made up that information. But there are still parents out there who are afraid their kids are going to get autism from getting a vaccination, even though it was totally bogus information. So now, sir, in answer to your question, vaccines have been in development, and we'll talk about COVID right now. So the COVID vaccine was in development 6-7 years before we got it for COVID, that type of vaccination. So it was studied before it got its emergency designation, because that was for COVID. But the type of vaccine has been studied and it has been determined to be safe. It just wasn't used before because we didn't have those viruses in order to widely distribute them, like the Ebola virus, for example. So are there methodologies out there for developing other vaccines? Well, you probably read there's this capsule that's going to come out. That's better than a needle, we think. Is it going to be as effective? Is it going to be as safe? We don't know yet. But we know that we are all part of this study. And for those of us who have gotten the vaccines, we think we've made the proper choices. I don't know that there is necessarily an answer to your question, sir.
Maybe.
Okay, and let me just say, and I do see Representative Stiver, but committee, let's try to condense our questions that are, so we can really get people's opinions specifically on this bill. If we attempt to research COVID around the world and diseases of the last 20 years, we will be here a lot longer than 5:30, and I'm cutting us off at 5:30, and we don't want to exclude some people from being able to testify. Representative Stiver, do you have actually a question?
Yes, I have a
Dr. Krantz?
question.
Okay,
All right.
about the bill.
Is it possible to get ahead of a virus that can mutate in species besides humans? And you brought the smallpox up. Was smallpox carried by animals?
That's
That's
an
historical
excellent question,
information I
Dr.
do
Krantz.
not have, sir. But you asked about variants. So we had the original coronavirus. We have the Delta variant now. There's a Lambda variant in Brazil. There's an Alpha variant in England. We think that the current vaccines are effective against all of these variants. We do not know how effective they are going to be, and there will be future variants as well.
Follow up? Okay, my understanding now is most of the people that's in the hospital here, and I have documentation, that they were all vaccinated. The majority of them were vaccinated in February.
Okay.
And that's internal documents from the hospital that I have got my hands on. So can you explain that?
Yes, sir, Madam Chairman.
Dr. Krantz.
So just this morning, I received the information. I'm on the hospital board here in Cheyenne. So I have access to the actual information. There are 34 individuals in the hospital. 28 are unvaccinated. 6 are fully vaccinated. Of those 34, 12 are in the intensive care unit and 11 are on ventilators. The 11 that are on ventilators are not vaccinated. The one other person in the intensive care unit that has been vaccinated is not on the ventilator. So that is the current data of today. So that's the accurate information from our hospital here.
And I saw that was on CRMC's Facebook, so, yep. Okay,
All right.
I think we're,
Thank you for your time and attention.
not that we're going to see any, I don't blame either of you, Dr. Krantz. I apologize. We're all trying to gather interesting information. We love this committee. It's so interesting. Okay.
Yes, ma'am. Thank you, Madam Chair.
Unless Dr. Krantz, did you have something else you wanted to add?
I wanted to just address one of the questions that I think my dad didn't about that I heard about a doctor in Cheyenne recommending against the COVID vaccination. And I do want to respond to that we are aware that there are doctors and other healthcare providers in our community and throughout the state that are giving bad information about COVID. And it's one of the things that we're working toward correcting and actually disciplining people who are spreading misinformation about COVID that is harming patients in a pandemic.
Okay. And no, we're not even going to ask any questions about that one. Representative Stiver, let's just hold off. We're going to, no, we don't need to hear a question right now. Thank you, Dr. Krantz. Okay, any more besides Ms. Graham? Welcome back up. Is there any more people that want to sit up here in the hot seats? Are the rest of you just observers? Really, your lives? No. Ms. Graham, welcome back.
Thank you so much,
Just for
Chairwoman.
general principle, introduce yourself
Yes.
for the committee, even though I know you were here before.
Yeah, my name is Susan Graham. I'm a resident of Laramie County. I'm also a doctor of naturopathy. I homeschooled 7 children and filed for immunization exemptions for all of them. And I know from the existing statute that there are already rules in place for when there happens to be an outbreak my children would have been brought back home if I had them in school programs. So there's already wonderfully stated statute that is in place for pockets of infection that might arise. I greatly appreciate the personal objection option, and I appreciate that you keep that in there. I wanted to address, as a naturopath, the accommodations portion in regards to essential businesses, especially when it comes to best helping my clients. Perhaps I use different techniques for evaluating their conditions than medical doctors, but I find that being able to actually be physically present with my clients so that I can observe how they smell, what their tongues look like, and how they feel, that helps me. And telehealth, which would be an accommodation to an unvaccinated or someone who doesn't have the ability to prove vaccination or is, in regards to HIPAA, unwilling to provide their status. I find it troubling that the best care to a patient for an essential business such as healthcare may not be best provided through an accommodation of virtual. Okay. To that point also, I understand and I do appreciate that you're trying to find a balance for business, corporation rights, and individual rights in this session. I do appreciate that. I would like to bring to your attention, in our Constitution, it's already present, Article 10, Section 5. And I have been in contact with the Secretary of State's office doing public records requests to find out which corporations in the state of Wyoming doing business actually have their certificates of authority. Because on the application for the certificate of authority, as well as the certificate of authority itself, it states that every corporation doing business in the state of Wyoming will assent to the law of the land, which is not statute. Actually, the law of the land is our state constitution, Article 1, Section 38, Part A. So Menards, for example, would interfere with my shopping experience and accommodate me by doing my shopping for me. Well, thank you, but I'd like to do my own shopping. And I would like you, as the legislative body, to consider that in finding a balance between business rights and individual rights. It turns out that the creator is never greater than the creature. Businesses are created, corporations profoundly are created by the state. And it is the people who created the state. So as we have in Article 1, Section 1, power is inherent in the people. I think that in trying to balance business rights with individual rights, you can see it's a false-based premise. It can't be done. Individual rights always trump business rights. We have it in the Constitution. The other point I wanted to make had to do with, my notes. Oh, yeah, and it's already been covered. The approval of the 5 years, and I understand you kind of pulled it out to get this legislation on the board. Appreciate that. Now, when it comes to clinical trials, phase 1, phase 2, phase 3 of experimental drugs, including biologics, which are what these mRNA vaccines and even the Johnson & Johnson nanoparticulate packeted, the clinical trials generally take anywhere, the phase 2, phase 3, not the phase 1 even, which is the animal trials, which we didn't have. But the phase 2, phase 3 usually take anywhere from 8 to 10 years themselves. So anywhere from start to finish, any experimental drug is supposed to have a 13-year trial. So I would suggest that rather than 5 years for any approval of a drug, an inoculation vaccine, that we would extend that period at least as long as a clinical trial would have taken place. So I thank you for listening. Do you have any questions?
Questions for Ms. Graham? Representative Ottman.
I just wanted to thank you for taking your time to come, Ms. Chairman. Thank you for taking the time to come. And I appreciate all of the background information that you've provided. Thank you.
Any questions on the right-hand side? I will just say, Ms. Graham, so one thing regarding the 5 years. So again, committee, I'm looking at the top of page 7. This is after the period administered by the Immunization Safety Office within the CDC. So the CDC does not put things on the pediatric list until it's been approved by the FDA after the clinical trials. So, I mean, that would be, but right, but ma'am, but the point is the CDC doesn't put them on the pediatric list until the completion of the clinical trials. So this would actually be after the completion of clinical trials. The other statement I did want to just say as far as the businesses is that many businesses in Wyoming are not corporations. And so you do not necessarily have to have any Secretary of State authorization for a business. Ma'am, yes?
The same is true of LLCs. They are made by the state, so they are under the people.
Thank you, Ms. Graham. Even not all businesses are LLCs either, just to put that in. For example, mine. Okay, any more people? You know what, Donna, let's see if the poor folks on the internet have you got still two, or are they increased or?
Yes, Madam Chair, I have two. Shall I admit
Okay,
them?
why don't you bring them in, or just pick one, and
I'll admit,
whoever you are out there out in outer space.
I'll
we'll
admit
get to
Brian
both.
Warren first.
Okay, just to have a little change.
I now have a total of three with their hands up.
Oh, okay, well, let's do all three. We've had more than three here. We'll go to.
Good afternoon, Madam Chair. Can you hear me?
Welcome, Mr. Warren. We can hear you fine. If you'll just introduce yourself and tell you if you belong to any organization, and
Excellent.
then let us know what you've got to say.
Thank you, Madam Chair. My name is Brian Warren, and I'm with the Biotechnology Innovation Organization. And we represent biotechnology companies, including the developers and manufacturers of vaccines. And at Bio, we stand for behind science, and we believe that immunization policies should follow the best available science. We respectfully oppose HB 1006 because it creates a new non-medical exemption from school immunization requirements. Establishing new non-medical exemptions would result in reduced immunization rates among the population. I'm going to try to skip some other things in the interest of brevity because I know a lot has been covered. I do want to point out, though, that the American Academy of Pediatrics estimates that the vaccination of a single year's cohort, so basically all the kids born in a year, saves 42,000 lives. And that's for every single year of children being born and vaccinated, and prevents as much as 20 million illnesses. Of course, that's across the country, I should clarify. Vaccines save money because avoided illnesses and deaths. Overall, that saves as much as 13.5 billion per year, and in direct medical costs, and 68 billion in total societal costs. So that includes things such as when parents have to take time off work and their employers are bearing the brunt of those their children's illnesses. No vaccine is 100% effective. I think that's been stated. And as well as the fact that not every single person can receive a vaccine. You have immunocompromised individuals who unfortunately are unable to receive vaccines. And which is why vaccines work best when we have high vaccination rates. We've heard a lot about herd immunity. We've heard about it today, and there's been a lot of talk about that as well during the COVID-19 discussion in this country. To address some of the questions that, Madam Chair, you have actually asked, states with personal belief exemptions have lower immunization rates than those who do not. For example, Colorado has lower immunization rates, at least on MMR and Tdap. Interestingly, I was just looking at the CDC's data, and it looks like Wyoming has a lower varicella vaccination rate. I don't know exactly why varicella is on the list of required vaccines. Some of the variations there can exist because of reporting differences, however. But there are other states with much higher exemption rates. And there's also been studies of states, including Texas, and I think it was Arkansas, where after the creation of a personal belief exemption, the vaccination rates decreased, i.e. the exemption rates increased. Because quite frankly, a personal belief exemption almost gets rid of a vaccine requirement, because all you have to do is say, I don't want to get the vaccine. There's evidence that parents sometimes opt to utilize a personal belief exemption simply because it was more convenient than getting the vaccine to claim an exemption. So We also, I would like to say that we object to the 5-year waiting period because we are aware of no actual evidence for this need, for a need for this. The dual regulatory role of the FDA and the CDC create a global gold standard in ensuring the safety and effectiveness of vaccines in the United States. State level regulations such as a 5-year waiting period is unnecessary and we believe could put students' health at risk. Right now, Wyoming has a school immunization program that works. There are already medical and religious exemptions in Wyoming. And actually overall, Wyoming is about average in the country. And this is average being a good thing in terms of actually trying to meet the herd immunity thresholds. And based on those rates, I think that maybe you were right that the vaccination rates that were on the 65% for MMR, there's a reporting error there because that does seem to be inconsistent with the data in terms of statewide immunization in Wyoming. But anyway, Madam Chair, thank you for your time. Happy to answer any questions, and we respectfully do oppose this bill.
Okay, super. Any questions for Mr. Warren? I really appreciate you actually being, Chris, I guess that was a benefit of you coming on a little bit later. You could do your searching, right? If you have in an easy way the information on the vaccination rates, and for the states that have, I counted them up, there are 19 with personal exemption. Could you email that to me? My email address is sue.wilson@wyoledge.gov. I mean, if you go on the Wyoming legislative page, you can find that easily enough. I would really, we'll be in session for another week or so, and that I think that would be really helpful. I would appreciate that if you could do that.
Yes, Madam Chair, I will do that. I know that there are some studies, as I mentioned, on how immunization rates have changed after the creation of a new non-medical exemption. And there's also some of that is just based on the CDC and its morbidity and mortality weekly report. They periodically, I think maybe it's annually, they report immunization rates. And I know that I think it's NCSL, the National Conference of State Legislatures, has a really convenient chart that may have been what you were looking at that lists which states have medical, religious, as well as personal belief exemptions. So I can send you all of that.
That would be super. Representative Outman, did you have a question?
Yes, Madam Chairman, and please excuse I'm not a scientific person, but what I'm wondering is how do you get to the point where you can say there's 47,000 people that didn't get this? How do you come to that conclusion of people that didn't get something? And the other thing I was wondering about was, I have to think about that.
Mr. Warren.
Thank you.
Thank you, Madam Chair. My understanding based on the study, and I'm not a scientist, nor am I a physician, and I was not part of the study. However, I believe this has been done in a number of different instances. I think the CDC has done it. The study I was referring to, because it looks at a single year's cohort of children, was done by the American Academy of Pediatrics. And I believe that what they look at is historical trends in terms of where the incidence of illness prior to a vaccine becoming available, as well as after it becoming available. I can send you that study, and I can try to see if I can come up with a more concise and well-informed description of exactly what their methodology was. But that's generally my understanding of how they modeled it.
Okay, thanks very much.
Thank you.
Donna, who have we got next?
Madam Chair, I admitted Janet Farmer.
All right. Ms. Farmer, welcome. Welcome back. Actually, we were in Education Committee, I think, the last time I was with you. So welcome to the Labor Committee. I'm not sure if you
thank you.
Glad to have you.
Thank you.
Introduce yourself for the committee, if you would.
My name is Janet Farmer. I am a school nurse in Laramie County School District Number 1 here in Cheyenne. Madam Chair, members of the committee, I would like to voice my opposition to this bill, and it stems really around the personal exemption phrase. Working in schools, and I have some agreement with the previous speaker, but I don't have any data. It's just anecdotal. I just feel that having the option of a personal exemption would lead to significantly lower immunization rates in our schools, and create that lack of herd immunity that we currently see on so many of those required immunizations. I have several colleagues in Colorado who speak frequently about their personal exemption and the low rates of immunizations that they have in their state. And I don't think that we want to go down that road. We have really good immunization rates and good compliance with those required immunizations in our state. The previous speaker did mention varicella and maybe add a question about why that one is lower. And again, this would just be anecdotal. I don't have any data to support this, but the varicella requirement did not go into effect until, I believe, 2010. And up until probably somewhere around 2015, maybe even 2018, parents could opt out of that requirement by just providing a statement saying that their child had had the disease. There was no confirmation of that required. So that may be part of the reason why that particular vaccine is lower. I do agree with both Dr. Kranz's that I truly believe that we would have lower vaccination rates across the state if there was the option for that personal exemption. And I feel that although I know that there are people out there who would use the personal exemption appropriately, I think there are an equal number of people that would use it as a means of convenience to just not get the vaccine.
Okay. Questions for Ms. Farmer? So I do have one. So are you actually opposed to the entire bill or only to the K-12 immunization paragraph?
I would be opposed only to the personal exemption as part of the K-12 immunization language.
I just wanted to clarify that. Okay, great. Representative Stiver.
Hello, Ms. Farmer.
Hey.
Through the chair. Now, you know, my son went
Mhm.
all through school here till at least his freshman year with a religious exemption.
Mhm.
And we went rounds over that a few times. I see no difference. It's still the parent's choice. It's parental rights. And it's already in statute. So I am for leaving the personal choice in. Thank you.
Was that a question? Oh, sorry, no, please, no applauding or any sort of things. We're very grim and boring here, and that's how it is just. Okay, thank you, Ms. Farmer, very much. And Donna,
Thank
one
you.
last thing. Who else have we got?
I admitted Boyd Brown.
Okay,
Madam Chair, Boyd Brown, Sheridan County.
welcome, Mr. Brown. I'm glad to see you looking healthy. And oops, he's not frozen up. I thought your picture froze up for the moment there. So, sorry, I interrupted your introduction of yourself. Go ahead.
Not a problem at all, Madam Chair. Boyd Brown, I live in Sheridan County right now. Just wanted to voice my opinion on this bill. I'm going to save where I'm at with how I feel about the bill until a little later probably. But I do believe, especially with the amount of interest you have in the bill, that it might be better served to go through a regular session rather than a special session. Again, I think there's some confusion about this bill being part of a bill to keep students from having to be vaccinated for COVID-19. And I don't believe that's not mandated at the state or national level at this time. I do believe that we've done some really good things with some of the other diseases that we've been able to cure with vaccinations. So I think it would be beneficial to run this through a general session or a regular session. I shouldn't say that because I believe this is a budget session coming up. I know that you guys worked on this as a committee, but think that it's kind of been sprung on us here at the last minute. I know I talked to some other folks who were not even aware that it was going to be out this afternoon. So I just think that it would be better to have a little more time, allow a few more people to have the opportunity to weigh in on this subject. And with that, I'll take questions.
Questions for Mr. Brown? Okay, thanks very much.
Thank you, ma'am.
we'll go back to the room here. Have we got any more folks who want to testify out here? Nobody. Okay, doke. Well then, public testimony is closed. Do I hear a motion on the bill? Moved by Ottman, seconded by Stivar. Then I know Representative Hallinan has got an amendment. Are there, before we, let me just, does everyone have Representative Hallinan's amendment? Okay, because yours is long, let's just, has the committee had a chance to read over Representative Hallinan's amendment? Okay, well, I guess actually we should probably do yours first, because then if people have other ones, they'll see if it works in with your language or not. Okay, so Representative Hallinan, he's got, go ahead and explain. Would you want to, can you all hear him if he sits here, or would you like him down at the front? Representative Hallinan, why don't you sit down in the front down there, just so that people can see your face and I can, you don't have to go looking sideways. Okay, so committee, we're doing well, actually. Well, we seem to have scared off some of the people who wanted to testify. There we are. No, I closed public testimony. We're done with public testimony. Do we need a 10-minute break now that I got Representative Hallinan out front? How are we doing? Representative Hallinan, I apologize. We're going to take a 10-minute break just because we've been here for a long time, some of us since 8 o'clock this morning, and we might need 10 minutes. So Donna, we're going to take a 10-minute break, and let's see, it's 4:22. Let's be back at 4:30. Okay. I know we're like, oh yeah, I wonder where am I at? Oh, actually, I have enough. I've got 75%. Ms. Stuybar, are you ready to explain to us your amendment? Ready? Representative Hallinan, are you ready to present the amendment? I beg your pardon. I was looking at it. Go ahead.
Well, thank you, Madam Chairman and committee. This is a rather long amendment, but I think the gist of it is fairly short. On page 1, line 1, after safety, insert specifying liability for employers whose employees suffer damages resulting from a required COVID-19 vaccine, specifying limits of liability. Line 8, after specified, insert requiring an employer to grant exemptions for any COVID-19 vaccine mandate, providing for damages. Line 1, or page 1, line 9, after definitions, insert making conforming amendments. And page 1, line 13, it has various sources for these changes. that
Okay, good.
show
And so
on
I
the-
did want to say,
on the
Representative
bill.
Hallinan, I'm glad that you started summarizing there. I was afraid you're going to read every word of the amendment. So please don't do that. Summarize for us. Thank you. Go
Okay.
ahead, Representative
All right.
Hallinan.
11142 is simply a matter of definitions, except on section B, where it says notwithstanding and subject to subsection C of this section, an employer shall be liable for all damages for injuries caused by a COVID-19 vaccination. That 1, the employer required or mandated the employee to receive as a condition of employment. And 2, the employee received only as a result of the requirement or mandate of the employer. Section C of that part shows that no damages shall be awarded or recovered in an action under this section for all damages for injuries that an employee suffers after 10 years from the date that the employee received the COVID-19 vaccination required or mandated by an employer. Then if you look over on page 3, it adds before religious on page 8 of the bill, line 17, medical. And that covers medical contraindications to, that's listed on item number B below that. Subject to the provisions of a subsection B of this section. If an employer requires vaccination for COVID-19 or enforces a COVID-19 vaccination requirement imposed by the federal government or any other entity, the employer shall grant an exemption as provided in this subsection. Exemptions shall be granted by the employer upon submission of written evidence of religious objection or medical contraindication to the administration of the COVID-19 vaccine, or written evidence that the employee is fully recovered from a COVID-19 infection. Section C shows an employer shall be liable in a civil action for damages of $5,000 or actual damages, whichever is greater, payable to the employee if the employer does not grant an exemption in violation of subsection B of this section and terminates the employee. Then on 27-14102 is simply a matter of definitions, except for item J, where it says an injury caused by a COVID-19 vaccination that an employee receives because the employer required or mandated the employee to receive the COVID-19 vaccination as used in this section. That's just saying what that is. That's saying that it is an injury and it would be covered as an injury. And then on 35-4-114, this is talking about the immunity that's granted in current law. And it says that except as provided in subsection F of this section under A and D, and subsection F says the immunity from liability provided in subsection A and D of this section shall not apply to damages, claims, or causes of action under the WS 1-142 and WS 2711 13313C. So what this bill, what this amendment does, just to summarize it, it adds to it that there are medical exemptions to the religious exemptions that are already included. And it also includes the written evidence that the employee is fully recovered from a COVID-19 infection. So that would give him the exemption from the COVID-19 being imposed by the employer. And also it has a penalty that is applied to the employer if he denies an exemption that the employee was entitled to by the law. Those would be $5,000 or actual damages. So that would be the kicker in the bill that would, or the amendment that would require that the employer grant the exemption. And finally, the part about the immunity from liability provided in subsection A and D of this section shall not apply to damages, claims, or causes of action under WS 1-142. So they would have exemptions that would have more strength because they are backed by a $5,000 fine and the damages that they actually suffered. And they also would have the ability to sue in order to recover the money that they lost because they got sick related to the shot. So that's the amendment.
Okay, questions for Representative Hallinan? Representative Connolly.
Thank you, Madam Chair. Representative Hallinan, I've got two different questions for you. So first, I was one of the people who wanted a little time to read this before you presented it. But when I read it, I think I've seen it before. So was this part of or a bill that was on the legislative website?
Representative Hallinan.
Yes, Representative Collin, it was, Madam Chairman. These items were on my bill,
Okay.
House Bill number 5. And this is just moving those items to this bill. Though actually I formed this amendment before I did the bill.
Thank you.
So
Madam Chair, just to follow up to that one. So Representative Hallinan, did HB 5 get moved to another committee?
yes,
To Minerals?
yes,
So Minerals is also looking at this.
yes, it is.
Okay. I'm not sure how I'm going to think about that, honestly. You're taking a couple bites of the apple. We all do that, I think, at times, but the reality is this is also being looked at in relation to the minerals bills that honestly are addressing more similar items, I think, than what we see in this bill. That's I think, an editorial comment there. Okay, but here's my question.
Actually, so before you ask that question,
Yeah.
but so Representative Hallinan, in your conversation with Minerals just before we all started at 2:30 today, did they end up tabling your bill there, or are they considering it?
Madam Chairman, I believe they are not considering it because it is a bill that I think that the sponsor of House Bill 101 liked the bill, but he wanted more in it. And so that's why I think he's tabled that bill. So this is the only place where these items exist other than what gets put into 101.
Okay, Okay, go ahead with your question.
Yeah,
then.
thank you, Madam Chair. Although I think we need to just check on that one because I hear that Minerals is trying to combine all three of the bills that they had into one of them. And so we don't know. You might have the many bites at the apple that you want, Representative Hallinan. But
All fruit salad.
right? And who knows what really is going on there. Okay, but my question is on page 3, line 14 and 15 of the amendment. And that the portion of it where an employer, where there are exemptions. And so exemptions can be granted by the employer on written evidence of the religious or the medical contraindication. But then it's also a written evidence that the employee is fully recovered from a COVID-19 infection. And I'm curious about that because it is my understanding, and luckily we have our 2 doctors still here, that the best practices right now is that regardless if you have had COVID-19, you should get vaccinated. And so because of that, I'm curious about the inclusion of that, or when best medical information right now, best medical practices say that vaccination is still important for those who have had and have recovered from COVID-19.
Representative Hallinan.
I might just add that just as a side comment about the fact that I'm taking 2 bites of the apple. I liked House Bill 1006 and I wanted to have something to go with it. I liked that bill originally, so I thought that was important to preserve that bill and to put this amendment on it. As to whether the previous infection, I think the evidence is that it's, at least what I've seen in things in studies that I have seen, it is 27 times as effective as the vaccine previous infection is. And that seems to be the amount of most of the people that I have studied, that I have looked at, do not feel that the vaccine is necessary for people that have had the infection. So that's what I have on that. I don't have anything other than that to say on that. But I think that the fact that it's 27 times as effective as the vaccine speaks pretty well for the issue. Thank you.
I think that was the study from Israel. More questions for Representative Hallinan. Representative Flitner.
Thank you, Madam Chairman. And Dr. Hallinan, just forgive my ignorance, but I'm not familiar with medical contraindication. I can probably figure that out, but I wondered if you could define that for me, please.
Representative Hallinan.
Various medications or vaccines or whatever have a medical contraindication because of complications that would result if they got that medicine or that vaccine. So there are things that are actually ruled out by a physician, right? Generally speaking, they would be ruled out for the use of that, for that treatment.
Thank you, Madam Chairman, and thank you. So then, just for instance, for my edification, then if I have a child and we know what's in the polio vaccine, there might be something to indicate within a blood test with my child that would contradict with that vaccine. Is that how you would know that? And so then with the case of the COVID vaccine, do we know what's in that vaccine? So how would we know if there was a contraindication?
Representative Hallinan.
Well, that's been covered partly by these CDC studies. I don't know that they've covered everything, but they've covered a lot of the things that would be a contraindication to use. So I think you have to rely upon your medical experts to some degree on that.
Okay. Actually, I do have on page, let me see, where did I? Oh, on page 4, the inserted paragraph J. And I understand that there are injuries caused by vaccination of any type. I mean, I get that. I'm not arguing with that. But as a matter of the injury and the liability, where it says any injury caused by the vaccination, I guess I'm wondering, is that just up to the court? You know, I mean, suppose a person has a stroke 4 weeks after they received a vaccination of any kind, I mean, whether it's COVID or anything else. Is there any way, a medical way of detecting the causation, or is that just a matter of court decision as to whether they think the stroke was a result? I mean, clearly there are some things, you know, like we had the bill a couple of years ago about, I think it was lung cancer or something, you know, an asbestos related type thing, that there was a presumption of causation if you're a firefighter. Okay, I mean, those are legal decisions. So is that what you're seeing in paragraph J?
I think so, Madam Chairman. I think so. I can't say what the courts would say about that. I think the amount of evidence that is produced by the experience with a product, they might think they would, you know, it's just by the occurrence of something many times with people, they would assume that that may be the cause of it. And I think courts are kind of liberal on understanding that. I think sometimes they do see causation, even where it may not be causation, but that's the way that works. That's how the courts work.
But I think that, I mean, we are not putting any presumptive determination in this.
No.
You know, I mean, we're not saying that any illness that ever happens to anybody within 2 months after a vaccination is presumptively caused.
No.
So that would, okay, I just trying to clarify that. Okay, more questions for Representative Hallinan. Representative Romero Martinez.
Thank you, Madam Chair. In regards to page 3, line 13, again, going back to, not to the medical contradiction part, but to the religious objection piece. How is it that we're defining that religious objection? I don't know if that's helpful.
Nope, right. So in other words, is the submission of written evidence, is it solely a statement by the person, or do they have to have a letter
Right.
from their rabbi or something, Representative Hallinan?
I think that, Madam Chairman, I think that Representative Martinez, that I think that the federal courts have interpreted that very broadly. And they have even assumed that that can be a firmly held belief, firmly held religious belief. It doesn't require, I don't believe that it has been required that it even be backed by a pastor or a religious leader, a priest. That person can simply have religious ideas, and I think that is sufficient for the courts now.
That is
So-
a statement on the Federal Department of Labor's website. What happens in the courts, of course, we don't always know, but so that would be aligned there. But you're right, it's not that clearly stated in the bill. More questions for Representative Hallinan? Okay, thank you, Representative Hallinan. Do I hear a motion on the amendment? Moved by Stivar, is there a second?
I'll second it.
Seconded by Representative Hallinan. Good, glad to see you have this courage of your convictions there. Okay, is there any discussion? Representative Ottman.
Madam Chairman, I hope this is in line, but what I'm wondering is with the intent of the bill, does this amendment complement it?
I think if we look at the enacting clause, it says, providing that requiring immunization as a condition of employment is a discriminatory or unfair employment practice as specified. Well, the liability, of course, he's inserting it into the enacting clause. I mean, I personally, and we have just Kathy, Representative Connolly and I, they're on the Rules Committee. It does seem to me that because we're talking about condition of employment, that it would fit, but I mean, that's a fair enough question. Representative Connolly.
Yeah, Madam Chair, I wondered the same thing, Representative Ottman. And always what worries me is that when you see, for example, on section 1, so on page 1, line 13 of the bill, that we are now changing that to add in 11142 and 354140, as well as changing the enacting clause. To me, it's saying that we are actually doing something new than what the bill is doing itself and what was meant to do.
It does add liability. You're right, that which is not addressed in the original bill. Okay. For follow-up?
Madam Chairman, yes, follow up, please. If, and this is just clarification, if it is to add more meat to the bill, that would be good. If it's to create a civil chaos, then that, is this clear enough in this amendment to make it so that these are, because I'm looking at it, but I don't know where it could go, to make it clear enough to, is this would be the repercussions of doing these actions, or that it would be caught up for years and years and years and years? Thank you.
So I'm not an attorney. I think that there are statements of potential civil action and enabling people to be liable, but those are decisions for the courts. I mean, basically it enables people to go to the courts. I mean, because it's not, otherwise there's no specificity beyond a court decision. And I'm not an attorney, so I'm just telling you, that's kind of my thought. Okay, I do have an amendment to the amendment, if people would like to consider this. On page 3, line 18, I'm a little concerned about the open-endedness of the phrase of actual damages, whichever is greater. So my amendment would be at the beginning of line 18 to delete of and put no more than, and then delete the words or actual damages, whichever is greater, comma. And I'll explain that if I have a second. No second. Okay, no. Well, okay. Then having a second. I'm just, so that would make it read for damages no more than $5,000. So the person could get up to $5,000 if they were violated. I just think the actual damages, seeing as there's no time period or anything, it seems very open-ended, and I find that a little bit problematic. I mean, if a person claimed and said, because you made me take this vaccine, I got sick, I had to stay home, my wife quit her job to take care of me, and now I lost my house. I mean, it just seems too vague to me, but that's just me, maybe. So is there any discussion of that? No. Question on that amendment? All in favor of that amendment to the amendment, please raise your hand. 1, 2, 3, 4, 5. Okay, 5. So that, right, that was accepted. What's the word? I'm lost. That passed. That's what we wanted. Okay, any other discussion of the amendment?
Madam Chair.
Representative Connolly.
Thank you, Madam Chair. I'd like to amend on page 3, line 14, to put a period after vaccine and delete the rest of the line and all of line 15.
Is there a second? Seconded by LeBeau.
Madam Chair.
Representative Connolly.
Thank you, Madam Chair. Representative Hallinan, it was able to very quickly pull up the article that you were talking about in Science Magazine that talked about the Israeli study and what they found that having the vaccine, having COVID was effective as the vaccine. But then there was an addendum at the end of it saying basically an oops. Actually, they didn't call it an oops, they called it a clarification. And that clarification talked about the limits of that study. And it was about having only one dose. So there were limitations to that study that came in on August 28th. So then I pulled up the Mayo Clinic, which is what I consider an incredibly reputable source in terms of getting information regarding the vaccine. And they clearly state that recent studies show that unvaccinated people who already had COVID-19 are more than twice as likely as fully vaccinated people to get reinfected with COVID-19. So I'm finding both some concern about the study that found that having COVID was enough to mitigate the evidence that says that a vaccine is valuable for those regardless of whether you've had COVID or not. And so going along with best practices, to me, it makes sense that we eliminate that clause.
Any other discussion? All in favor of Representative Connolly's amendment to delete the previous infection part? Please raise your hand if you're in favor of it. 1, 2. Okay, that doesn't pass. Any other discussion? Representative Romero Martinez.
I just wanted to add a comment that we're in committee, so I could mention a leader's name, right? So the Bishop of the Roman Catholic Diocese has said that there's really no exemption that should really be considered other than medical. And I just wanted to put that out there for point of reference in case anybody didn't know that. And the reason why is because people talk about religious exemptions all the time, but then maybe they haven't even talked to their bishop in a while or read their newspaper. And I just wanted to make that comment. Thank you.
So are you making an amendment?
I would hereby like to make an amendment to remove the religious objection piece on that
Is there a
basis.
second? Sorry, no second.
And just a follow-up comment, even if that doesn't fly, at least the bare minimum is that it be known that that's the stance of the leadership. So
Of
I
that
think they think about
particular
that. Thank you.
denomination, which of course a person could have a religious objection from a lot of other places.
Sure. Thank you, ma'am.
Okay, any final changes to this before we vote on it? Okay, so because this is just the amendment, we can, we'll just go with hands. All in favor of Representative Hallinan's amendment, please raise your hand. Oh, what's that? What was that? Stuttering ones. I'll look the other way while you think. 1, 2, 2. Sorry, the amendment is failed. Okay, are there any other amendments proposed? Representative Connolly. I forgot we're on 1006. It seems like we've been on this for about a year.
Okay.
Of course, you've been working on it since June, so.
Thank you, Madam Chair. I'd like to make an amendment that on page 6, line 11, and page 8, line 18, that we remove the personal objection language.
Okay, discussion?
Madam Chair?
Representative Connolly.
Thank you, Madam Chair. I've been very convinced by the testimony that we heard that that including a personal objection, in addition to the religious and medical contraindication, would cause harm as opposed to good. And I truly believe it is our obligation to do good and to not cause harm. I was able to pull up Colorado. You had mentioned Colorado and then the great Google environment of pulling up Colorado. Colorado, which has the ability to have a personal exemption, is very seriously taking a look at tightening it, and with the understanding that they need to tighten it. And so there's some of the data that's coming out of Colorado, the state right to the south of us, that they found that they have 90% more cases of whooping cough than states with more stringent requirements. That to me is a shocking number. And then when I went down, it's like, how much are we talking about? And it's only schools with exemption rates as low as 2 to 4%. 2 to 4% of vaccine exemptions are finding that they no longer have that herd immunity, and they have a greater risk of outbreaks. They go on to say they are 22 to 35 more times likely to get measles than vaccinated children, right? Those numbers to me are enormous and what we would expect. So if we thought that there would be more, but it wouldn't be that many, the reality is what they have found in Colorado and in other states is that they are reducing their herd immunity so that there are outbreaks, and those outbreaks are serious. And I am of a generation where there weren't all the vaccines, right? I'm of the generation where there was still polio. I have friends who had polio, right? I remembered, I told this story, when I was about 5 or 6, I fell out of bed. And the concern of the neighborhood was I had polio. I was a klutz, but I fell out of bed. And actually it was such a big deal because they needed to get me to a doctor and all the dads were working, moms didn't have cars. How are they going to get me to a doctor? Because of the incredible concern that I had polio and what would need to happen if that was the case. I remember standing in line to get the little sugar cube under my tongue. And I also remember that my youngest brother, it was before the rubella vaccine was available, and he got German measles. And the concern was that he would go blind. It was so bad. I am so incredibly grateful. And I don't want that to happen to any other generation, And that allowing for kind of personal exemptions, right, could cause that problem. Our obligation is to do the hard work. It's easy to just put in, I think it's easy, honestly, to include personal in here. I think it's a whole lot harder to go home and say, no, we didn't do that because we are obligated to care for our kids. That's the harder thing to do. And so we have evidence that vaccines work. We have evidence that if we include a personal exemption, that the likelihood of infection, the likelihood of disease is going to happen. And so I would strongly encourage us to do the hard work and strike personal in those two places.
More discussion? Representative Flitner.
Madam Chairman, thank you. And I agree with you. I am a child of the 60s as well. And I guess maybe it was because I stood in line along with everybody else at Lynch Elementary School and took my shot in the arm. I am a mother who believed in vaccines. So I worry too about that insertion of that language and what it could do and the harm that it could do within our public school system and our society as a whole. I understand, though, the concern about requiring parents to subject a child to a vaccine that is unapproved. And I believe that that is that is the great concern too with most people, is that we're dealing with approved vaccines within our school system like polio or MMR as opposed to a vaccine, the COVID vaccine, which has not yet been approved. But I do agree with the bringer of the amendment, and I will be voting aye.
More discussion? I'm just going to ask the committee's thoughts on this. I'm thinking of offering, and I don't know if this is a friendly amendment or not, but to divide it, because there are two separate things at issue here. On page 6, it is dealing with pediatric K-12 immunizations. And on page 8, it is dealing with employer required, which is an adult who has had, presumably, I mean, not necessarily, but the essential vaccinations. And I don't know if that would make, I won't, I guess is that a friendly amendment or not really? You can say no.
Madam Chair, I think as chair, you could certainly divide the amendment. I'll probably vote aye on both portions of it, but why don't we divide it?
Okay, then if I'm going to divide the amendment, just in case it processes differently for people, because I feel like, they are separate issues. I mean, I understand you're perfectly within your rights to bring them both at the same time, but so we'll vote first, I think, unless there's any further discussion. I don't think so. I don't think we ever do on the floor.
If you can divide it.
Okay, Representative Stivard, did you have a question or a discussion?
Yes, Madam Chairman. I'm going to be a no vote on this. I think it still goes back to parental rights, 142206. All right, as me as a parent, I know what's best for my child. All right, and I think putting the personal objections in there, I mean, it's going to go a long ways everywhere. So I'm going to be a no vote.
I'm okay. Okay.
All right. And again, 142206, parental rights.
Okay. Well, remember, no clapping. Sorry. Sorry. I understand, but you just have to think in your head. Okay. So the first part that we will vote on is on, just making sure I'm the right part. Page 6, line 11, to strike, let's see, to strike the changes. So it would go back to religious objection or with comma, or medical contraindication. I'm not sure why the comma is there. That's an inserted comma. Religious objection or medical contraindication. Okay. So if you're in favor of that amendment, please raise your hand. 1, 2, 3, 4, 5. Okay, so that passes. Then on page 8, line 18, all those in favor of striking or personal, please raise your hand. 1, 2, 3. Okay, so that fails. Okay, so we've changed the pediatric part and kept the adult part. Okay, any more amendments on the bill?
Madam Chair.
Representative Connolly.
Thank you, Madam Chair. On page 7, I'd move to strike subsection 4.
Is there a second?
I have to find it first.
Page 7, top of page 7. Paragraph 4. The 5-year limitation. Okay, is there a second? Seconded by LeBeau. I have to remember LeBeau. Any discussion?
Madam Chair, just briefly,
Representative Connolly.
again, I've been convinced by the medical experts that there has been enough vetting through the variety of medical entities in terms of assuring the safety of vaccines that this 5-year period was you said it yourself, you kind of made it up, you pulled it out of your pocket, and that it is an unnecessary delay in getting the kind of immunizations that are necessary for our kids.
Keeping in mind, of course, that having this in there would not prohibit a parent from getting a CDC approved immunization for their child. It just keeps it off the school list. I mean, just to be clear. Representative Ottman, did you have a question?
Yes, well, kind of a comment on this is going back. Working in the school district, it was procedure for employees and children alike, is that if you had a cold and you went to the doctor, they could prescribe this or this or this. If you had a virus, you were sent home because there wasn't anything. What I'm trying to go back to with comments that I make is that if a person sees the medical professionals that they are agreeing with and looking to for guidance, if they see that, yay, get an inoculation, do whatever it is that you want to do. But if I have reservations and the data that I happen to see or get a hold of, or the people that have witnessed to me or the things that I've seen disagree with that, then I should have that option also. There are lots of reasons not to mandate. People would not say, I'm not getting a vaccination for my child so that they would die. You know, that this is something I believe we should have liberty on. And especially if we want to do the 5 years, which at least that would give it time. We do not have all of the information, all of the data collected. It is still from one side of the country to the other, to different households, to different age groups, to all kinds of different situations, whether they be elderly in nursing homes, whether they be individuals at home. All of that data is still being collected. So to say that this is the only way to go and that I shouldn't have a personal reservation until something is proven to be the best interest for me and my family, I just think we have to have some kind of safeguards. So I would vote no on removing this. Thank you.
More discussion? Okay, then I'll just take for a show of hands. All those in favor of the amendment to remove paragraph 4 about the 5-year waiting period before putting K-12 vaccines on the school list. So if you're in favor of deleting that paragraph, please raise your hand. 1, 2, opposed? 1, 2, 3, 4, okay, 5. All right, so that fails. Any more? All right. No further amendments being heard. Donna, would you call the vote, please?
This is a roll call vote on House Bill 1006 as amended. Representative Connolly?
No.
Representative Flitner? Representative Hallinan?
Aye.
Representative LeBeau? Representative Ottman?
Aye.
Representative Romero Martinez?
Aye.
Representative Stivar?
Aye.
Representative Wharf?
Excused.
Chairman Wilson?
Aye. Okay. So that's the end of our work for today, committee. I don't really know what we'll get down the hall from the Senate in a few days. We shall await events and see. Thank you, audience. I do want to say kudos to the folks in the audience. I know this is a very contentious issue. We've certainly dealt with contentious issues in this committee We've had pro-life related issue, abortion related issues. We've had death penalty issues. And I hate to put this in but I think, just being able to have civil discussion, whatever is going on in the inside of your head is a win. So thank you all for that. And remember, the process continues forward. We will continue on. There will be committee of the whole, potential for amendments there, third reading and amendments. And then because we didn't accept the rules for the special session, then it will go down the hall and it will be heard again in the Senate. So there will be opportunity for testimony as well in the Senate, which I don't know what the schedule for that is, but that will be available as well. So thanks for all being here and have a great week.